So here I would like to go through the clinical trial steps that has to be done before a new medication can be introduced into the market. So the first one is phase 1, which we would study the effect of a drug on healthy individuals. So once, for instance, you develop a new drug that is for cancer, you don't directly jump and test it in cancer patients. First, you will test it in healthy individuals. And the purpose of that is to find out the actual side effects in normal people and the safety of a drug. So if you test it right away in cancer patients, you wouldn't know whether it's the effect of the drug that is causing all these side effects and the problems, or is it the progression of the cancer. So the first one is in small number of healthy individuals. The second phase of the clinical trial would be small number of sick patients. So let's say, for argument's sake, that we are introducing a new anti-cancer medication. So now we are testing in a few patients that have cancer, and the purpose is actually to check the efficacy, dosing, and the side effects. So dosing and the side effects in patients that have cancer. So once it passes successfully this phase and it shows some positive results, then you can move on to the third phase, which would be testing in a large number of sick patients. So if it was like, let's say 50 or 60 patients that we were testing here, now here we will test in the amount of like thousands of patients that have cancer. And so the purpose of phase 3 is actually to compare the efficiency of this new medication to the old one. So let's say our drug is called drug A compared to the past drug, which was drug B and was used for the treatment of cancer. How efficient is our drug compared to the old one? And once it passes phase 3, then you will introduce that into the market by phase 4, but still you will have to follow up on that one. So you would post-market surveillance would be for phase 4, post-market surveillance. And the purpose of this phase 4 is to find out what happens in long term. So here we will be following the effect of medication in like a few months or maybe maximum a few years. But here for phase 4, the effect will be followed for many years, let's say 20 or 30 years, and find out what's going to happen then. In addition, because there are a much larger number of patients that are taking the medications, we would be able to find the rare side effects that are associated with the new medication that is introduced in the market. And that concludes our discussion.